I'm Major Tina Williams. I'm a certified occupational health nurse specialist working with the Idaho Army National Guard. I have 12 years of experience, and 3 of those years I served at National Guard Bureau as the Chief Occupational Health Nurse for the 54 states and territories and the District of Columbia. Over the past few years, I've noticed an increase in liver function enzymes in my medical surveillance program as I monitor my mechanics that work in our Army National Guard. So I reached out to my colleagues and I said, hey, have you seen this phenomenon? I said, yeah. I'm like, so what is it? I said, I don't know. When you find out, let us know. So without further ado, let's research this question. We go back to the nursing process that we're all familiar with. We assess the situation. We conduct and document nursing assessments, the health status of employees, and the environments in which they work. We look at their work sites, how they work, the way they work, what their ventilation is, how they're exposed, what they're exposed to. We have industrial hygienists come in and assess the workplace, document hazards, communicate those hazards to us so that we can surveil our mechanics who are exposed to occupational hazards. And then we have medical surveillance for our employees who, as we know, we cannot eliminate all hazards from the workplace. So therefore, they're in our medical surveillance program, and we document those results. Then we diagnose, analyze, and assess the data to establish or modify our nursing diagnoses to be used on a basis for nursing interventions. So we compare our physicals from year to year, from their baseline, and in this case, when we hire employees and we do a pre-placement exam or a baseline exam, they had normal liver functions. So why now, 6, 9 years later, do they have elevated liver functions? What is causing this? Is it work? Is it home? Is it something else? So we identify the health needs of our employees. We work with community resources. We identify trends. And then we identify priorities for our organization and for the employee. Then we establish a plan. Developing a plan of care based on the nursing assessment and diagnosis that prescribes interventions and attain expected outcomes. Planning nursing interventions will consider collaborating with the employee, collaborating with others in our interagency, the shop supervisor, command staff, the additional duty safety officer in each of the facilities. We maintain an environment conducive to safety and well-being, and providing health teaching and counseling for each of our employees in medical surveillance. And then we intervene. That implements the plan of the nursing interventions for the employee by writing nursing interventions in our civilian employee medical record for each employee that's in the medical surveillance program, giving direct care in the case of an emergency, which we hope never happens, but we're prepared to do that as nurses, determining the responsibilities that can properly and safely delegate to the occupational health or industrial hygiene technicians, and communicate the interventions and responses to other members of the organization that's required or relevant. And then we evaluate. And this part often we forget to do because we're moving on to the next project, but it's so important in the whole process of the nursing process. Evaluate the responses of the employee and the organization. Reassess the employee and the organization as appropriate. Modify nursing diagnoses, revising strategies, and implementing changes in the nursing intervention. And then evaluate again, right? So the industrial hygiene or occupational health responsibilities in this nursing process cycle is to evaluate the workplace exposures, identify individuals that are at risk of an exposure, work with safety to decrease those exposures as much as reasonably possible while still completing the mission, and then implement workplace controls. And you know we have to document, because if we didn't document it, then we didn't do it, correct? Right. So we document it in the civilian employee medical record, sometimes maybe the military medical record, if appropriate. And if there's an overexposure, it must go on the OSHA 300 log as an incidental exposure. Then we communicate, and the best way to communicate is through processes that are already required within our organization without adding more work to our workload. That's through the Safety and Occupational Health Council, the FECA Council for the Federal Employee Compensation Act, the accident investigation boards, if appropriate, or the design review boards. So we can remediate the hazards before we even build the facility or remodel them. Increase that ventilation instead of surveilling employees overexposed, right? And then report. If you assess a facility, just like an employee, then report it to the supervisor or what their findings that you found and recommendations for them to remediate them. So without further ado, let's get into the medical surveillance of this. It is a statutory requirement from public law all the way down to an NGR. So our policies involve the 29 CFR 1910 for all our mechanics and other federal employees. The Department of Defense 6055.05, the AR 40-5, the preventive medicine or to be public health regulation, the DAPAM 40-11, Chapter 5. So let's get on with this. So 40-11, the DAPAM specifically indicates that we are to surveil the program, implement risk-based medical screenings. That's right, risk-based, not everyone. And then determine the occupational disease or illness that might be associated with the task due to their chemical exposure as they're working. So medical surveillance is the #1 priority for all occupational health nurses. Why? It's a statutory requirement. That is why in the Army funding guidance, it is statutory requirement 0, which means it gets funded along with pay and benefits, the #1 priority above almost all other requirements in the Department of Defense. 1, we can identify employees not fit for the job, not able to conduct the task, or we can identify exposure hazards in the workplace. Medical surveillance criteria includes completing the hazard assessment along with the facility shop supervisor or the employee, or both, identify those that are potentially exposed to hazards requiring medical surveillance, surveilling the hazard and identifying the hazards that are over the action level that can be remediated or not, and engineering out all hazards that can be engineered out, for that is the first priority before we get all the way down to providing personal protective equipment. Replace the hazard or the chemical processes with a less hazardous, and enter the employees that you cannot remove their hazards and still above the action level into a medical surveillance program. So we look at the industrial hygiene surveys and look at those tasks that our employees are exposed to, and those employees that are required to be in a medical surveillance program. We can do pre-placement exams before we even hire them to make sure that they're physically fit for the job and that their liver is healthy enough to even be exposed to grinding off nuts and bolts in the shop that exposes them to cadmium, right? And then periodically, and depending on their exposure, that might be every year, every 2 years, every 3 years, right? Or just an initial or a termination exam. So depending on their hazards, depends on how often we conduct medical surveillance. And what kind of medical surveillance? So in this case, we're going to talk about what affects the liver. Physical components consist of all kinds of things depending on the employee. Most everyone, the audiogram, for example, most soldiers are exposed to noise, and we know that. There's only so much remediation that we can do to decrease noise. But what about liver function? So we look at the Federal Occupational Health Guidelines. We can see on this graph that almost all the job codes require an audiogram. However, none of the job codes require liver function. So wait a minute, why are we testing liver function and nobody requires it? Because it's a hazard-based medical surveillance program. We know that we have toxins and tasks that affect the liver. If you go through all your STS chemical inventories of all the chemicals that our employees are exposed to, are all of them not exposing the liver, or do some of them expose the liver? I challenge you to look at all your brake cleaners across the state and see which ones target the liver and which ones don't target the liver. So the liver consists of 3 major enzymes, protein enzymes, that we can monitor and track from their baseline, periodic, and termination exams. The AST, the ALT, and the GTT. They're just blood enzymes, but they're very important ones when it comes to the liver. So let's take cadmium, for example. We know that some of our mechanics are exposed to cadmium when they grind off nuts and bolts. So what does cadmium do? Exactly, it's an anti-rust agent, because we don't want our vehicles or our aircraft to fall apart due to rust, right? But then when they need to fix something, those nuts and bolts are on so tight they can't get them off, and they have to grind them off, and they aerosolize all this cadmium. And are they wearing a respirator? Good question. Most of the time, yes, we all have a pretty good program, and those that require to be on the respiratory protection program have a respirator, they're properly fit tested, they're in your medical surveillance program, the employees are trained, they wear their respirator, and they do a good job. Then, after they're done on their day's work, they take their air compressor and they blow off their workstation. Now where did all those heavy metals go? Exactly, up in the air. Industrial hygiene has found that the majority of our heavy metal exposures come from cleaning our workstations, not by conducting the tasks. So here we go. We re-educate and try to decrease these hazards by disallowing and forbidding our employees from using the air compressor to clean off their workstations, and use a wet method or a HEPA vac, another procedure to be able to have a clean working environment, decrease our heavy metals in the workplace, but not aerosolizing them so that they get into our lung system and then metabolized by the liver. So what are all our liver hazards here in the Army National Guard? Well, we just talked about cadmium. We talked about inappropriate cadmium exposure by using the air compressor. What about chemicals, like we briefly discussed, that affect the liver as a target organ? I had asked one of my facilities, I was like, can you just scrub your SDS binder and find out what chemicals are the target organ to the liver? And they scrubbed their entire SDS binder, and they came away with one particular brake fluid that was a target organ of the liver. So I challenged them. I was like, is there another brake cleaner that would work just as good, do the job, not increase the time that it takes to clean the part, and not affect the liver? So they made a few phone calls, spent a whole 15-20 minutes on this little task, found a brake cleaner that had no offensive odor. In fact, the mechanic said that it actually smelled a lot better and was not offensive. It cleaned just as well, and it made their hands a little softer afterwards. They kind of liked that part. And the byproduct was water. So the chemical agent cleaned the part just as good, did not attack the liver, and the mechanics liked it better because it didn't stink up the whole shop every time they cleaned a part. Therefore, they were able to reduce the liver hazard in their shop to where now we don't have to surveil their liver in their shop at all anymore. They no longer have any liver hazards in their facility. So what else attacks the liver? Well, that's all that I'm aware of in our facilities. However, what are some other things that are maybe not in our facilities? Non-work related autoimmune diseases, hepatitis, alcohol, Tylenol consumption. Well, these are things that we don't typically concern ourselves with as an occupational health nurse because we want to keep them safe at work. However, you can see how having a conversation with our mechanics of what liver hazards are, then they can make decisions on and off the job. So what is it that our liver does? Well, in fact, our liver is a pretty mighty organ, and it does a lot of things. If you typically just think about metabolism, our liver is the heart of metabolism. It metabolizes many, many toxins to make them less toxic, so filter it out of our body. It filters the majority of our blood every time it cycles through our body. It metabolizes many medications. What are our medications that our employees are taking? That's a good question. It also metabolizes our triglycerides. Yeah, we don't typically get triglycerides during a work task, but where are they getting their triglycerides, right? Animal proteins, saturated fats, food-like substances like fast foods, energy drinks, microwavable foods, processed meats. The liver really does help us to keep as healthy as possible. And it also metabolizes a lot of vitamins like A, D, E, and K. So as you can see, our liver does a lot. We often don't give it a lot of credit. But what can we do to support our liver health? Through education in our employees that do and are exposed to liver toxins in the workplace or may be diagnosed with an autoimmune disease or have high triglycerides, what are some things that we can educate our employees about their liver health? Well, making healthier choices day in and day out about what we put in our bodies can support our liver health. Choosing things like baked, broiled, grilled over deep fried is a healthier choice, and over time gives the liver a break so it can continue to metabolize the things where, yeah, we did enjoy some birthday cake. Why not? There's also specific foods that are really good for the liver that the liver can expeditiously work a lot more efficiently and better when consumed, like olive oil, turmeric, walnuts, grains, vegetables, broccoli, avocados. So including more of these kinds of foods can give our liver a break and help it to be able to decrease the toxins even faster and more efficiently in our body. So the main goal with any employee that shows high liver function levels is to have them come back in 4 to 6 weeks and retest their liver function. Because as you know as nurses, once we know that somebody has an abnormal finding, then what do we have to do? Exactly, we have to do something. We have to One, communicate that this is an abnormality for our employee, and then give recommendations on how to improve that abnormality. So one, we put them on a hepatotoxin restriction, and a lot of times that in itself will do a lot of education for the shop, because the first thing the shop chief's going to ask is, what's a whatever restriction, right? And so then you get an opportunity to talk about what liver function toxins they have in the workplace, and that what their employee cannot be exposed to during this time period till we get the liver functions back down to normal limits, and educating our employees about liver health. It's interesting to note that just in the recent, since 2016 to present, increased diagnoses in non-alcoholic fatty liver disease. Now this diagnosis is, I believe, underdiagnosed, because not everyone goes in and says, can I have a liver function test, please? I think that's the last thing that we would ever think of asking for when we have a periodic exam with our primary care physician. But as we increase our diet load of triglycerides and processed foods, what I've discovered in my recent research is the higher the triglycerides, or the higher of the alcohol consumption, then the higher the liver functions. But those individuals that admittedly have an increase in alcohol consumptions may or may not have high triglycerides. So their liver functions will be high, known as alcoholic liver cirrhosis, versus non-alcoholic fatty liver disease. Now, the amazing thing about the liver is that it will function and metabolize until 95% of the liver is completely cirrhosed. As you can see in this graphic, a cirrhosed liver looks pretty bad, and it is cancerous. And if you've ever heard of anyone that has been diagnosed with liver cancer, they will follow with, my doctor gave me X amount of months to live. And prior to going to the doctor saying, I'm feeling so tired and my skin is yellow and all these symptoms of high liver function levels, their liver is already 95% gone. Our liver is so efficient to being able to teeter-totter and balance all our hormones and sugars and proteins and everything in our body, that it compensates and compensates until 95% gone, and that's when you start showing signs and symptoms, when it's too late. So the great thing about being an occupational health nurse and identifying these increased liver enzymes after our mechanics were brought into the field, into their shops as mechanics with a normal liver, and now all of a sudden has increased liver enzymes. 30% of my mechanics that had increased liver function after this presentation was able to decrease their liver functions within normal limits within 12 months. Otherwise, they would have never known. And so now we're on a road to where we are more educated about our liver health, liver toxins, what we can do about it at work and at home, and make lifestyle changes to have a healthier liver so that we can endure and metabolize and be able to continue to grind off nuts and bolts, clean breaks, and do our job without it attacking our liver, because we have a healthy liver that can metabolize it in a normal process in everyday activity. So our goal is to continue to maintain and work towards the teeter-totter over to the healthy liver and away from the cirrhosis liver, and not stay in that fatty liver disease. So together, between industrial hygiene, safety, medical, and occupational health, we can support our mechanics who are literally on the ground in the shops, maintaining our air and ground equipment so that we can continue to fight the fight and support our nation here and abroad. Thank you for your time.